one. Professor Martin Green and Avnish Goyal, welcome to the Care Home Show. This is going to be a special COVID-19 Q&A call where we've invited operators from within the sector to get involved in the discussion around COVID-19 today. So welcome, gentlemen, and everyone else who's joining us for the show today.
Thanks.
So, as per last time, we've got a group of questions that we've basically accumulated from a number of operators within the sector. So it would be great to be able to run these past you, Martin, to get your perspective on things as well. And obviously, the plan will be to open up the discussion to the wider audiences as well, to be able to explore the concepts, the challenges, the opportunities, and things that have kind of come to light since our last conversation, if you will. So, yeah, great to have you on the show, and let's get moving with this. So, Laura Burkett of Buckland Care asked, so Martin, in your view, when do you think we'll see more regular testing for care staff?
Well, I think that programme has started. I think also, though, I want to see it not only about testing, but I want the track and trace to also be part of that, because what we need regular testing, and I don't think the government has really understood that testing is not one activity to do, and then when you've done everybody, that's it. We need to have regular testing. We also need to have track and trace, and I've talked to Baroness Harwood, leading track and trace, and I've suggested to her that she might want to pilot this in the care sector.
And how have those conversations gone so far, Martin?
No, they've gone very well, and I think Lady Harding's really clear that she wants track and trace to be rolled out as quickly as possible to the whole of the country. But I think she realises that she might have to do some pilot work, so the care sector would be a good place for that to start.
Okay, great. And just for anyone that doesn't kind of understand the full concept, if you like, around the track and trace side of things, are you able just to give kind of a high level overview on exactly what you mean there when you say track and trace for the care sector?
Well, what it is, it's an app which people will have on their mobile phones. What it will do is, if you become symptomatic or you have a test which says that you're positive, the people that you've been in contact with, or indeed the people you come into contact with, if they've also got the app, it will send a message. So what we will see is, we will see, first of all, who has got COVID-19, either symptoms or test results. And then if you come into contact with them, because of the way in which your phones will interact, you will then get a message to say you've been in contact with somebody, you need to get tested. And then the testing program needs to also be able to respond to that very quickly. So what this should do is, it should really help us whenever we are in contact with somebody who might either be symptomatic or have had a COVID-19 test, to be able to then swiftly lock down the fact that you've had some contact with them. Now, of course, for the care sector, this might also produce some staffing issues, because the moment people know when they've been in contact, they will have to go into the quarantine process as well as the testing process. So, of course, that could cause some issues around how we support staff, and how we also make sure that there are enough staff in each service.
Got you. Okay. And I guess as far as it being the most proactive approach to dealing with the virus on a kind of person by person basis, that seems like the most practical response, if you like. Do we know where we're at from a technological perspective to make that kind of a reality, if you will?
Yeah, we're very far advanced, and in fact there has been a pilot going on the Isle of Wight, and now we're pretty ready now to roll that out. So I expect government announcements probably within this week or early next week.
Got you. Okay. Well, hopefully that work that you've been doing will pay off, and that the pilot will begin in the care sector in the not too distant future. So hopefully that will be welcomed from the sector itself. So. Next question again from Laura. So her next point was to ask, so do you think that councils will be paying, should be providing void payments in order to prevent the closure of homes?
I certainly do, Laura. And one of the things that I've been working on is to try and make people understand that actually for the financial security of the sector, we need to have a guaranteed occupancy level. The way I've pitched this would also be to remind the NHS that when they are coming out of this, there will be a lot of people who will need elective surgery. And what they will need is people to be moved very quickly out of hospital. So in effect, they could kill two birds with one stone. They could support the care sector through having a guaranteed occupancy level, and I'd said 90% should be the target, but that would then give the capacity within the sector to move people out of hospital when they are post-operative for either convalescence or reablement, and then that will help to have a through flow in hospitals, and it will bring the elective surgery backlog down. So I think from the point of view of how it's pitched, it's a very much a win-win situation. The challenge, as always, is about local authorities. And when you start to talk to local authorities, they don't like it because, of course, the NHS will buy that capacity at a reasonable rate. And local authorities are hugely underfunding care. And they don't want either capacity to be taken out of their own system, or indeed, they don't want their underfunding to be exposed by this initiative. So as at the start of this pandemic, we tried to get the NHS to agree an amount for people moving out of hospital, and we failed. Well, the reason we failed was because the moment the LGA saw it, they didn't like it and they pressurised government. And one of the things this pandemic has really shown is that this should not be left to local authorities. When you have a pandemic, which is a global pandemic, why the hell do you need to be reliant on hundreds of local authorities deciding how they respond differently? This is a moment when we need clear, centralised control.
And it's about making the whole, the wider healthcare system work together, which is obviously a drum that we've all been banging for quite a long time. But it feels like if there was ever an opportunity to try and make this whole system work, then this really needs to be it.
Indeed.
So, so a question from Michael Butcher at Blackadder Corp, who run a portfolio of homes in the Midlands. So, his questions was around Wren Hall and Friars Lodge, two homes that apparently are in the process of closing, or that have closed. My apologies, I don't know specifically whether they have or not, but should we be bracing for more closures, and what can we learn from the news that we've heard about Wren Hall and Friars Lodge?
Well, I think the first thing to say is that both Wren Hall and Friars Lodge will be losses to the care sector. There'll be a loss in terms of the amount of care and support they've offered to the people who support them, and that will not be available in their locality. But secondly, it's also really, really difficult for the staff and the people who've worked in those care homes, because they've shown real commitment. And I certainly know Wren Hall very well, and it's a really good service, and that's the sort of service we can ill afford to lose. But I think that this will produce a lot of capacity going out to the market. Some of it will be driven by the finances, because, you know, smaller providers particularly have no capacity to bridge cash flow gaps, and that's why we need to have a real clear position from government. But there will also be lots of providers who find themselves in the position where they have lost lots of residents, and they will think to themselves, now is my moment to exit the market, because they will be completely emotionally and financially exhausted by what's happened in this pandemic. And of course, that will be very, very difficult for the sector, because it will reduce capacity, perhaps at a time when we'll need more.
Yeah, absolutely. Maybe this is a good opportunity to ask some of the people on the call for their perspective on this. If anyone can kind of put their hands up using the app, and just let Sally know if people have got questions on that particular point. Sally, can you see people who would like to contribute to that discussion?
I can see Mitesh's hand is up.
They're not. What they need to do is actually where it says reactions on the bottom of your taskbar, if you click on there, and it'll ask you whether you want to raise your hand or not, and then we'll know that you have a question.
My apologies, I should have explained that to begin with. So, yeah, I think Mahesh had a question that he wanted to ask in line with that. So, Mahesh, go for it. What would how would you like to kind of follow on from Martin's point there?
Clearly, I think Martin has a very good strategy in terms of what he's saying. It's a pandemic. It's a global issue. It should be nationally driven. We're in a position at the moment which we should not have been from the beginning, from the start. How do we actually then change the course, Martin? How do we go about, as a whole care sector, to make government listen? I know you're doing it. Everyone is trying to do it. But what is the best way of trying to achieve this, not just for the pandemic, but also for the future of care in terms of the long-term vision that we all have?
That's a great point, thank you, Mahesh.
Yeah, Mahesh, that's a really good point. And I think from the national point of view, there are two really big ways that I'm trying to do that. The first is through the media. Now, I had tried to do that through proper negotiation behind the scenes, and I would much prefer to do that. That would be my preferred option. But quite clearly, the local authorities were having more sway with the government than we were. So my next strategy was to go into the media, because they are starting to realise that if they've got the media against them, governments need to react quickly. So I think we've seen greater emphasis on care homes in the media, and we need to keep that up. In terms of where we're going and what can happen at a local level, I think one of the most important things you can do is keep feeding in your experiences to people like Care England, so that we can identify where there are problems and specifically say to government, actually, that's not happening in this area or that area. So I think that connection between the centre and what's you're experiencing on the ground is probably the best way that we can make sure that all our messages are aligned.
Agreed, Martin. I think as you are aware, and I think a lot of the providers are aware, the local authorities, with the COVID funding they actually got, have created bureaucracy. They will be inconsistent. I've got 3 care homes in 3 different local authorities, completely different way of doing things, and the information they need to publish is on the 29th of May, which again, from your point, the financial insecurity or the situation with Brent Hall and the Priory Lodge has created the issue. And if the government had acted quickly, or the local authority had actually realized and then enabled the financial support quickly, it would have been much easier, or make it. I think they could have simplified a lot of things by saying, if it's based on registered number of beds, or like as you said, occupancy level, I think that's a good idea. But again, it's just the messages are getting there, but it's not getting, the actions are not getting there. That's what my point is.
Yeah, Mahesh, I couldn't agree more. And there is no reason. What I'd suggested was they should identify through the Care Quality Commission where everybody is. They should have identified an amount, which was an extra amount for COVID and business sustainability, and they should have delivered that directly to the care provider. And I did make the point that the Care Quality Commission has got everybody's bank details, because despite the fact they're not continuing their role, they're still taking money out of care providers. So it would have been relatively easy to do. In the Republic of Ireland, what they did was they identified that for the first 50 beds, you would get an extra, I think it was €600 a month for your residents, and then after that you'd be getting it's 800 a month, then 400 a month, and then after that an extra, I think it was 250 a month. Now this was a way of delivering direct support to the front line of care, and that's exactly what should have happened here. And I have to say, this pandemic has exposed a whole lot of nonsense around localism, not least of which is the bureaucracy and the way in which these local authorities have an endless capacity to pad their own bureaucracy rather than to put money into services. And when this is over, there will be a public inquiry, and these are some of the issues that we need to put front of house in that inquiry.
Agreed. And I think, just to give an example, Shropshire County Council has not given any uplift either this year. They said no uplift for care homes. So again, you've got kind of double whammy.
Yeah, it's exactly, Mahesh. And let's not forget, those councils have had 3.2 billion. They've just got another extra 600 million. And yet they're still, in some areas, saying no uplifts. This is completely disgraceful. And there needs to be a really clear audit trail. And what I've said to ministers is there will be nowhere to hide, because we have told them this is not getting through to the front line. So if there are failures, if there are disasters, the responsibility will go up to the Secretary of State's desk.
Perfect. Thank you, Martin.
Thanks.
Cheers, Mahesh. Great questions. Thank you for your input as well. So moving on to the next question. So Helen Parsons-Davies of Gormy Care Communities asked, so Martin, do you feel that the general public's confidence in the care sector has increased or decreased as a result of the number of reported deaths that we've had from COVID-19?
Well, hello, Helen. I mean, I think there's a real paradox here. I think for the first time, the public has really connected with care and they understand us better. But the problem has been, because care homes have been at the very centre of this initiative in terms of it being the area where most people are affected. And of course, most people in care services have some underlying health conditions. So what we've seen is things like the death rates and the data has undermined people's confidence in care homes. So I think what we've got to do is, first of all, we've got to use the fact that they understand what we do better and understand the fact that we do make an enormous contribution to people's lives. And then we've got to turn that into renewed confidence in the sector. And that confidence in the sector will have been dented by the fact that people are seeing now daily statistics as to how many people have died in care services. I think the other problem that we have in this country is we're one of the few countries who are not issuing the statistics of people who have recovered from COVID-19. And if you look at that, you then see a much more balanced picture. Obviously, the care homes, because people are very frail when they're in a care home, they have lots of underlying health conditions, the morbidity rates are going to be higher. But I also know of a case where a 98-year-old man had COVID and then has recovered from it. So I think some of those stories getting into the public domain will make people understand that this is not a very black and white issue, that it has nuances and shades of grey. But we need to be really clear. As we move out of this pandemic, we need to be constantly reappraising for people what care homes do and underlining the fact that they give good quality lives to people who are extremely frail.
Yeah, absolutely. One of the things that keeps going through my mind is the fact that I don't think typically members of the public really understand kind of why social care is so important, exactly what it does, and how it kind of integrates with the wider healthcare system. And it's whilst we're doing everything that we can to try and create a more kind of balanced narrative and things, I think until the members of the public really understand those three things, it does feel like a bit of an uphill struggle, despite all the great work that is being done, unfortunately.
No, I think it is an uphill struggle. And of course, in the public's mind, and let's not forget, the public's had 70 years of understanding the NHS. And of course, what they think is that when you go into an NHS institution, you go in and you get cured. That's not necessarily true, but that's their perception. They have another perception, which is that you go into a care home, and when you go into a care home, it's about loss of independence, it's about loss of those qualities that people have really valued in their life. And so they don't understand that it's about an appropriate support for people who have lots of health conditions. It was brilliantly brought home to me by a woman I spoke to in a care home. And she had been struggling at home for the last 9 years since her husband had died. And she said to me, I never went out, I never did any of those things. And then she came into the care home and she said to me, I have done things that I haven't done for 20 years, like go out and buy new clothes, like go to a concert, things that were about improving the quality of her life. Those stories are the ones we need to get out there.
Yeah, absolutely. No, couldn't agree more. It's a shame that a lot of the media just doesn't pick up on a lot of the amazing stuff that does just happen on a day by day basis. That links quite nicely into a question from
apologies,
Sharon.
Simon, apologies. We have a question from Graham.
Oh, okay, great. Graham, go for it.
Hello, Martin again.
Hello, Graham. Hi.
It was on the previous point actually about voids. 2 points to it. The 90% occupancy figure that you were saying you were hoping to try and achieve. I think the key point is as well is how long that would be, if we got that far, how long that would be put in place for. Because I think as providers, the pipeline for new referrals has in some instances completely dried up. And certainly when I wear my Leeds Care Association hat on, a lot of our members are saying it's nil. So even post-COVID, we're going to have a situation where the actual period of time between post-COVID and actually getting back to normal pipeline levels of occupancy are going to be significant. So it's important that providers are helped through that stage as well. So that's the first point I would like to make. The second point is I was on a Leeds Silver strategic meeting this morning. They call them bronze, silver, and all that kind of jazz. But Kath Roth, the head of Leeds City Council Adult Social Care, announced this morning that the Leeds' allocation of the 600 million, which she said was 8.8 million, that 75% of that, under the guidelines from central government, was that just to get that money out to care homes in Leeds. So all the work and the pressure, I think, has been applied onto local authorities as to where the first 3.2 billion has gone. And I know one of my questions today was about how much pressure can we put on their accountability where that money is going. It appears that what she said was she's going to distribute 75% of it to all the care homes in Leeds. That's both private and public. She didn't say the criteria around that, but what she did say was that she had it clearly instructed that that money had to go out to care homes ASAP. So that was on the face of it very encouraging news. And so I just wanted to say thank you for the work you're doing, because I think the message to central government that local authorities are not sending this money out, I think has got there, because the guidance that she was referring to seems it's quite explicit. It's got to get out. So 75%, I think, is what she quoted was the amount they were going to send out of each local authority's allocation. So you as providers on this call should be immediately asking what those providers are doing. And she was going to speak to her finance director this afternoon and look at payments immediately to all the care homes in the Leeds. So I think that's a big positive step that I heard from this morning.
Well, I'm really pleased to hear that, Graham. In terms of your first question, I was thinking that this transitional occupancy level should be a 12 to 18 month time frame, because I think it will take 12 to 18 people to bridge that gap and also to re-establish a life as normal. I'm really pleased to hear about the 600 million going, 75% of it going directly to care homes. Though, of course, what I really want to focus on is the 3.2 billion and why that hasn't gone directly to care services. But I think, I think you're right. There was a lot of pressure put on, and I wrote a letter to the minister, and she had a telephone conversation with me just after she got the letter, and she began it by saying, I've received your snotty letter. And I said to her, well, yes, you have received my snotty letter, because I have been trying to work behind the scenes with you appropriately. And also, I want to pay tribute to Helen Whately, the minister. She has fought tenaciously to get that 3.2 billion and then extra. But of course, unless it gets to people on the front line, frankly, the announcements could say 300 billion. And if it doesn't get to where it needs to get, then it's not effective. And the other thing to say about what Leeds said was that it's great to know that 75% is going to the front line, but I'm also very interested where the other 25% is going. This is a huge amount of money. Did she make any comment on that, Graham?
The other 25 was to be used for things like PPE, resource, clinical support into those care homes. So that was the reason why she said 25 would be held back. Well, she didn't use the word held back. She said we're just working out how that should be spent. But it was encouraging that they were keeping that for key things that the care homes might be struggling with. But the key message was that 75 was hit, would hit care homes quite quickly this week. She gave the allusion. Well, Leeds is a big authority, so for me, I thought that was fantastically positive news for the group today.
No, I think that is positive news. And also her justification of where the 25% was going to, I think that's a legitimate justification as well. So on that level, I think Leeds are to be commended. And now you give me that feedback, I think I shall write to the director and tell her that, because one of the things that we need to do is support authorities that are behaving well in this.
Yes, absolutely. I mean, I'm a domiciliary care provider as well. We've got a few local authorities, and some of the people on today's call have mentioned it. We still haven't had any support, and they say we're still waiting and seeing what to do. I mean, it is quite unbelievable that we've got authorities. It's in the northeast. I won't say who it is. I'll let you know privately. But they're saying, well, we'll wait and see before we do anything. It is unbelievable.
No, it is unbelievable, because we are now, a long way into this pandemic, and we need direct, quick, swift action. And I have to say, I've been really concerned about domiciliary care services, about their access to PPE, about how they're being supported to make sure that they have enough staff to deliver. There seems to be no understanding from either local or central government also about people who have their own personal assistants, and how do they get PPE, how do they get protection. So another thing that has been exposed in this pandemic is the lack of clarity about where people who are receiving care are and how we get the support they need directly to them.
Would anyone else like to contribute on that particular point just before we move on? No? Okay, cool. So Oliver Thomas, who ran the Bupa portfolio of homes up until 2013 and now is still very active, involved in the sector, he said, okay, so Martin, how do you think that the current pressure on government regarding care homes is likely to play out? And also, what can the sector do to maintain the pressure that is already on the government?
Well, hello, Oliver. Good to hear from you. And my view is that what we've got to do is just keep up the pressure in the media. It's become very apparent from this pandemic that when there is a lot of media activity, then there is a lot of knee-jerk from government. And we saw that at the announcements this weekend, where there was an attempt to rewrite history. And on the Andrew Marr show, there was a quote which was thrown back at Michael Gove, a quote from Jeremy Richardson at Four Seasons Healthcare, and a quote from me saying, well, if we were the priorities at the start of this pandemic, neither of us realised that, because certainly, you will have experienced this on the ground. People were not being seen as a priority, and in fact, the care sector was being ignored by the NHS, and worse than ignored, in some care areas, we were losing things like our support from primary care and district nursing. So I do not believe that we had been at the centre of their thinking, and there's plenty of evidence to say that. Now, the moment those things get into the media, then that means government starts to react. But I think that also one of the things you can all do, though I know it's much more difficult for care providers who have direct relationships with their commissioners, one of the things that is also very helpful is if people put this into their local media, so that it becomes something that the council leader starts to become aware of when the local newspaper is saying, what's your response to what's been said? And if it's difficult for care providers to do this directly, I know lots of relatives who would do it for you. And one of the things that's been fantastic about this pandemic is, by and large, the way in which relatives have shown their support to care providers. I did 2 phone-ins, one on the Radio 4 You and Yours programme, one on Radio 5 Live. And these were, 45, 50-minute phone-ins. And what I got was a catalogue of relatives telling me how amazing the care providers had been in supporting their relatives who were residents in care homes. And normally when I go onto those sorts of programs, there's usually a whinge fest. It's all about, care providers who are making a fortune and all those usual myths that are completely incorrect but get thrown into the ether. Well, this time it wasn't. It was about people saying, we really appreciate you. So I think at a local level, Oliver, that may be one of the things that you can harness.
Great stuff. Thank you very much. Joanne Balmer, I know she's got a question. She's also on the line at the moment. Sally, are you all right to free up Joanne so she can ask her question?
She's unmuted now.
Thanks.
Hey, Joanne.
Yeah. So my question also links into the media, and we constantly see this stream of negative media using very emotive language, such as calling care homes killer homes and ravaged by the virus, etc. And of course, some homes have been terribly affected, which I'm sympathetic and mindful of. But the constant stream of negativity is damaging the entire sector, and so inquiries for private referrals into care homes that may not have been affected by COVID, they're not just reducing, they've simply stopped. And if we don't start to turn the tide on this as a sector in relation to media, then it's going to have a long-lasting damaging impact on the entire sector and all care homes. So my question is, what can we do, or what can be done to move the media on from where we are now, from portraying care homes as killer places to live? And secondly, what can be done to try and encourage the multitude of independent providers to join voices together through avenues like Care England, rather than having lots of people using lots of channels and feeding negativity into the media, so that we can enable public confidence to be regained, and so that people feel that it is safe to move into good care homes?
Well, I think two very good points. The first one is about the negativity, and I have to say one of the big problems in this country is our media. We have not got a sophisticated or very helpful media. You know, one of the things that I'm absolutely outraged about is the way in which the BBC, with 3.7 billion of licence payers' money, supposedly upholding the best broadcasting standards, have dumbed themselves down to the level of a tabloid. And you may have heard my spat with Nick Robinson on the Today programme about that. It was really interesting. I've been interviewed by so many media outlets in this last pandemic. And what's really interesting, the ones that were proper in their approach to, asking questions rather than making everything emotive, were Al Jazeera, who gave a very, very informed piece, Sky News, who did a documentary which I thought was fairly balanced, and it showed a terrible side of what was going on, but it was also fairly balanced. Russia Today, who were also quite balanced in their approach. But if I want to look to hysteria and negativity and also putting words in people's mouth, I only have to look to just about all the newspapers, probably with the exception of the Financial Times, which is a really good paper. And also, you know, the local papers have been a bit more, I think, balanced in this. But I don't underestimate, Joanne, how difficult it is to get those positive messages across. But I think we just have to continue to make sure that we are putting the best foot forward. Though, of course, the paradox has been that if I had gone on to all this media and said, oh, well, things aren't as bad as people are saying in care homes, that would have meant care homes were ignored. So I think there's a timing issue as well. And as we're starting to see this get into a more normalized pattern, I need to start challenging some of the stuff, and the messaging needs to be more positive. I think at a local level, Joanne, I think it's really important that you continue to put positive stories into the public domain. So interestingly, really great example. The other day I wrote to a care home because they had what might be described as a disco. And what they'd done was they got families to come into the car park, so they were socially distanced in their cars, and residents were in their rooms, but there was that real connection between. Now, that was a very good example of how the media picked up on that, and there were positive messages. And of course, it gave the media opportunities to talk to the relatives and to some residents, both of whom said really positive things about the care home. Not only how it had responded to this crisis, but also in general, what an amazing job the care home and the staff do. So I think we've got to pace ourselves a bit and start, should we say, nuancing the messages a bit now. But it's a big challenge, Joanne. I don't underestimate how big a challenge it is. In terms of how we get people to join associations, my view is we're trying our level best, but of course it is a very difficult situation for care homes because they are very cash strapped. And the challenge is to get them to understand the benefits of belonging to an association. Of course, what people see in associations is usually people like me doing the advocacy stuff. And then smaller providers think, well, why do I want to be involved in that? But actually behind us, there are huge numbers of services that will save you money. So we've got links to citation, giving fantastic advice on things like, how you deal with the HR functions. We've got amazing links to people who provide systems for care homes. We've got a shop that provides really good priced commodities, partly because we have all these large corporates in place, so we can get the economies of scale and transfer them to smaller providers. So I think one of the things people should do is look at membership in the round and see, it's like everybody. When I sit behind my desk, when I'm making decisions about what things I involve with, a lot of them are about the bottom line. So if you say to yourself, why would I be involved with Care England? Well, there's the stuff that goes on advocating for the sector, but go on our website and see the list of things where you can save money for your bottom line. And those are the things that should also drive membership. And also, if you think we're not doing what you need us to do, and that's why you're not joining, I hope those people will tell me. I might respond by saying, well, the majority of my members like it this way. Or I might respond by saying, that's a really great challenge. Let's see how we can respond to you.
Excellent. Any other points from anyone else relevant to the question or what Martin's brought up so far? Nope. Okay, cool. Okay, so one of the questions was from the whole leadership team at Adept Care Group. So can the 250 employee restriction on claiming SSP for COVID-19 be removed retrospectively?
Well, that's something that I'm desperately trying to work on. I think it's going to be more difficult to get it removed retrospectively. To get it removed is our challenge at the moment, and then to go into retrospective stuff after that. And I think one of the challenges we have is that people don't realise how labour intensive our sector is, and actually relatively small organisations go way above that 250 employee mark. So for them, this is a major challenge in terms of the budget and what it does to their organisation. And to reassure you that it is on our horizon, and we are working very hard to try and remove that requirement. But again, we are one of many people who are having that conversation with the Chancellor. I think where we differentiate ourselves, though, is that we're actually part of that essential infrastructure of the health and social care system. So that will be the thing that would give us a bit of an edge over some other sectors.
Makes sense. Thank you, Martin. Robin Sidebottom from Balorum Care. I understand that you've got a question that you'd like to be able to ask as well. Robin, what would you like to ask Martin? Or have we got
Robin, I think you're not on mute, but we can't hear you.
There we go. Can you hear me now?
Yeah, we can. Yeah.
There we go. Hi, Martin. How are you doing?
Hello, Robin. Hi.
I guess my question, I've sort of got three parts to a question, but I'll just ask the main one because I think it's probably the more relevant one. I think you've already been talking about it. We all know around the sort of postcode lottery, and the facts are clear that the government has passed the money to local authorities. It's not being spent on the front line, and we've picked up various bits of intelligence that some local authorities are using COVID money, for example, to prop up libraries and leisure centres, etc. So I'm sure there are lots of stories out there. Which, interestingly, one of the councils actually hasn't provided an annual uplift. has provided very little COVID support and is allegedly propping up their libraries and leisure centres. So there's a bit of a story there, isn't there? But is it not time now for us to look at that sort of common sense approach, to look at the national framework? And you remember, Martin, back in the day with Scottish Care that we had the National Care Home Agreement that was in place, which bizarrely is sort of falling apart at the moment, which is a bit crazy, really. Is it not time for us to be looking at that national framework to say we need to have, one, either regionally or nationally, a minimum agreed rate across the country?
Yeah, I mean, my view is we've got to do that. Though, of course, lots of care providers have always been nervous of that, because for some, particularly those who are in the private pay market, it might be a figure for the local authority provision, which would be significantly below what they're currently getting. So it's always been a challenge. And in fact, we've never really had a consensus in our sector in England as to whether or not we could go down that road. Now, in domiciliary care, of course, the United Kingdom Home Care Association produce every year their benchmark for what care should cost, and we have not done that. But I think one of the things we need to do is to think about that in the future, because I do think it would give us more leverage in the debate. And in a way, on some levels during this pandemic, I've tried to short circuit a bit and to say to NHS England, for example, well, I think you need to have a rate which might be regionally adjusted, but a rate for transfer of people from hospital. And I pitched that at £1,500 a week. Now, of course, for some colleagues in the northeast of England, they were absolutely over the moon about that, because they're currently being paid less than £500 a week. But also for some colleagues in the southeast who are significantly higher than that in their rate, that was not a good rate for them. So it's this balance point, I guess.
Yeah, I think there is a regional perspective to that, Martin. I absolutely agree on that. But there are some commonalities across the country, and certainly we've been in battles recently with bizarrely, actually, West Midlands seem to be worse than the North East when it comes to fee rates. And we had a long running battle with Wolverhampton Council, who think that £460 a week for residential is an acceptable amount. So I think we have to get some sort of a minimum, and then there are regional differences as we go through.
Yeah, I think that's right. And I have to say, one of the things that I've done, over the last couple of years is give the hourly rate. So when you start talking about £480, you then translate that to about, I think it's £270 an hour or something. And when you start confronting people with what you're delivering for £270 an hour, anybody can get their head around why that isn't enough.
Absolutely. Just one sort of sub question, if I may, from that. Cynically, do you think, Martin, that in some areas that local authorities are specifically pitching low rates because they want providers to fail?
Yes, I do think that's the case. And in fact, we've had some comments been made by some local authorities who've said things like, well, we don't like residential care. This might be the moment when we realign it. Well, actually, this is completely and utterly ridiculous. The reality is there are many people who have so many morbidities and are suffering with, advanced dementias. They cannot be effectively managed at home. Well, certainly they can't be managed at home on the way in which local authorities currently do it. Now, if they wanted to say, those local authorities, yes, we're going to put 5 people round the clock to look after this person, as they do in some other sectors, then that would be fine. But they're not going to do that. And again, it exposes the ageism. And what they want to do, these local authorities, they want people with high-level needs to be placed in their own home where they're paying for their accommodation, and they want to give them low-level support to the point where they will then go into a crisis. They will either fall or there'll be some catastrophic issue. They'll then go to hospital, and they will then go to a care home. But of course, the care home will only be there for them for about the last 4 months of their life, because they haven't been brought in at the right point. So I do think there's a real challenge around some local authorities who are putting dogma before people.
Excellent. Thank you.
Thanks, Robin. So a question from Priyan Dewani, who says, we're very grateful for the temporary suspension of VAT on PPE. but that also that care homes are disadvantaged by not being able to claim back VAT on all purchases. Given the government's stated desire to help the sector, how can Care England help try to secure zero VAT status for care homes, and could this be achieved in the next few months?
Well, hello, Priyan. First thing to say is we did a lot of work to get a temporary suspension, but that hasn't stopped our work that we're doing to try and get the VAT at zero rated. And in fact, we were about to issue court proceedings, and we have taken council's opinion, and we're discussing that with the Treasury at the moment. So even though we're in the midst of a pandemic, we have not taken our foot off the gas in terms of pushing this issue for the longer term. And ironically, the short-term withdrawal of VAT can really help our case, and we can show that this is something the government can do, which will tangibly support care providers, and it will not mean enormous amounts of lost revenue to government.
That's great. Any points from anyone else on that particular response from Martin there? Anyone?
There's no hands raised.
No hands raised. Okay, sure. So Rachel Dryden, who she's on the call actually, maybe she'd like to ask the question herself. Rachel, do you want to put your hand up if you're keen to ask the question yourself? Yeah. Can you see? Hey, Rachel.
She's unmuted.
Thanks, Simon. Martin, my question is, lots of carers can't afford to be off sick, given SSP is less than £100 a week. And unfortunately, not all operators can afford to offer enhanced sick pay. Given the significant support for other workers through the furlough scheme, can we lobby government for more support for our care homes in the coming months to prevent COVID-19 inadvertently entering care homes via our workers?
Yeah, hello, Rachel. I think that's a really good point. And in fact, that's the point we have made to the government, because we want the government really, in effect, to extend the furloughing scheme for care workers, because if a care worker has to be absent from their role, often these are people who are literally struggling financially, and this may mean that some care workers think, well, I can go back to work sooner than probably they should, and that then can lead to transmission and entry into care homes. So I think we've got a really, I suppose, powerful case to say we should be a bit of an exception, because our colleagues are in that space where the stakes are very high, both for them personally, but also for the people in the care home. And we have raised this with government. We will continue to do so, Rachel, because I think you're absolutely right. It can be a risk factor, both for the individual worker, but also for the people in care services.
Thanks, Martin.
Thanks.
Great. Any other points relevant to SSP and the furlough situation from anyone on the call today? Nope. Okay, super. So Dr. Will Andrews from Country Living Care Group says, testing asymptomatic staff and homes doesn't make sense unless it's done continuously every week to pick up new cases as they emerge. And even then there is little benefit because the tests take about a week to come through. So if positive, obviously there's a gap in the response. As a management team, we've decided not to do blanket asymptomatic testing because of this. We think that this could be done so, we could do so. Basically, by doing so, this could open up some liability. What are your kind of expectations around this, Martin?
Well, I think you're absolutely right, Will. One of the challenges is that the system is not geared up to be able to deliver pretty instant results. And we need a situation where people are tested and we get the results, within 24 hours or less. And unless we have that, it's very difficult then to really use testing effectively. If we can get quicker testing, if we can get track and trace, and also the point you make, Will, is a really important one. We need to have this as a continual process, not something that's just a snapshot in time. Now, if we can get all those things together, I think then it will be very useful to do that tracking and tracing and testing process. The issue about opening yourself to liability, I think that's another area that we have been very focused on, and we've been talking to the department about how they need to try and restrict liabilities within the care sector in the same way that they've done for themselves and the NHS. And I think one of the challenges will be that after this pandemic, we might well see a group of sort of litigant lawyer ambulance chasers ready to take cases, and that can make an enormous impact on people's ability to continue. And likewise, I think what we're going to see is insurance premiums quite significantly rising. We've already seen there are a few insurance providers who have decided to exit this market completely. They'll continue with the people they're currently insuring, but they won't insure new people. So also our insurance rates will be higher because there'll be less choice for people to have insurance. So I think the points that you make, Will, are really valid, and it's a judgment call for you as a senior management team as to which way you jump on this, I guess. But if we can get quick results, continuous testing, combined with track and trace, I think those are the things that could make a paradigm shift in how this pandemic develops.
Great stuff. Thank you, Martin. So we've got about 7 minutes before we wrap things up. Does anyone else who's on the call at the moment have any other questions that they'd like to be able to run past Martin? No more. Okay, great. Okay, well, that's fantastic. And Martin, thank you so much for sharing your insights, your foresights, and your kind of knowledge and experiences on where we are to date. I guess kind of just a kind of a last question to you. Kind of let's kind of summarise where we are today as a sector and what needs to be done kind of moving forward for the people that are on the call and the people that will be listening on the podcast when we release this tomorrow morning.
Well, I think where we are as a sector is that we've proven ourselves to be incredibly resilient, sometimes in the face of not very helpful support from either local or national government. We are also in a position, though, where we have lost a lot of our residents, and that has two implications. The first is the public relations one that we talked about earlier, and the second is the amounts of money that takes out of a business. So we're a sector that in the future needs to re-establish public confidence, but we also need support to bridge our funding gap, because as been eloquently said on this call by colleagues and their questions, we are now in a position where we are not seeing people coming into care homes, but we are losing people, and that then creates a significant financial impact in our sector. So coming out of this, I want us to look, first of all, at how we reposition ourselves. We need to make sure that we have a connection with the public and redefine what social care does for them. We need to think about an emergency funding and support package, and then we need to think longer term about social care funding reform. And we also need to look at those issues around parity of esteem with the NHS. And what I want to see are proper career structures. I want to see recognition and reward for our fantastic colleagues who work so amazingly hard. I want us to see access to the enormous amounts of money spent on training in the NHS. You know, £100,000 a minute taxpayers put into training, and only in the NHS. Well, if this is an integrated system, that money needs to be available to us all, because we need a workforce that can move seamlessly between systems, just as people who are citizens who use different systems. So people may be in a care home or getting domiciliary care, then they find themselves in a hospital. So we've got to get that understanding that we're part of a continuum of care. We need the respect and the money that goes with that.
Excellent. Well, Martin, thank you so much for your time this morning, and thank you everyone who's contributed questions and that's been on the call today. It's been great, and yeah, we'll be launching this episode at 7 o'clock tomorrow morning. That will be so that's Tuesday 19th of May, and hopefully we can catch up again in the next couple of weeks and do another check-in and another Q&A and see kind of where we are in the next few weeks' time. But thank you very much to everyone that's been involved today. Really appreciate it.
Thanks. Bye everyone. Bye. Thanks a lot.
Bye now.